All right, welcome everybody. We don't really need a microphone. We have a great session today on global health and MOOCs. We have 3 panelists, and we're going to have them do a 10-12 minute presentation for you each, and then we're going to have some discussion, and this is great. We'll be able to have some very intimate discussion with our small group. So first I'd like to introduce Rebecca Stoeckle, and you have their bio sketches, so I'm not going to go into extensive depth, but she's the Vice President in EDC's Health and Human Development Division, where she directs initiatives in health and technology with an emphasis in e-learning. And she's going to talk about access for all, designing online resources for uptake and impact in developing contexts. Welcome, Rebecca.
Thank you, Carrie.
I guess we can leave it then.
Thanks. You guys see the hardy few who've stayed with us through the long day. I'm really honored to be here with my fellow panelists, with all of you, and I'm honored to bring with me digital representations of Fatima and Ahmed, who are 2 of our online global users. We have a habit, a practice in our workplace meetings. We have too many meetings, but we always begin them with an image and a quote pulled from our learning forums from the past 24 hours from one of our global users as a way of reminding us all of us Western folks who are developing this work, who we really work for. Russell, I promised you were going to see a quote that you'd already given to us. I think it captures what the panelists this morning were talking about in terms of the upside of MOOC potential. And here's the companion quote. This is the danger of talking late in the day, is that you sort of rehash the tropes that have become very well worn. But this phrase of digital postcards from gated communities is one that really motivates me to think deeply hard and with humility about what we're doing and how we do it. So how do we do about this? How do we avoid that trap? We know that adults learn best when they're able to engage interactively and socially with information and tools that they can apply in real time to real problems that they have in real work settings. So you have to wonder why we would apply the linear framework of a typical classroom environment to the work that we're doing online. We need approaches that, if we are going to effectively reach and engage users who are low income, low literacy, and especially low techno-literacy, we need to think about what we're doing in new ways. So we start by asking ourselves, how do we learn best, right? We know that the deepest learning outcomes are those that are self-directed and appealing and relevant. They're not linear, they're exploratory and messy and driven by discovery and engagement. And we can replicate that online. And because most of us are doing work that's aimed at adult learners, I think it's also important to ask about how do we work best. These are also images of some of our online learners. They're at a plastics recycling plant at one of our micro enterprises in Tunisia. We have plenty of data that shows that optimum work outcomes require opportunities to collaborate, access to excellent resources and tools, and some autonomy to self-direct. And if you think about the way that we all work and the way that we who have had the opportunity to work on the ground in developing contexts work alongside people, sometimes people work best alone, sometimes they work better in teams, sometimes they need to get up from their screens, move around, and try things. So hands-on opportunities for learning are really important. For most of this presentation, I'm going to use a case example of something that we developed with generous support from the Hewlett-Packard Corporation. We like to think of it as more than a MOOC. It's HP Life. Life stands for Learning Initiative for Entrepreneurs, and it's a cloud-based platform aimed at livelihood creation, chiefly for micro-entrepreneurs. We currently have about 180,000 users in 185 countries around the world. We're virtually everywhere except the Central African Republic, and we're adding new users at a rate of about 1,000 a day. So we have very significant uptake. Who are our users? Roughly 90% of them are in developing contexts. But it bears noting that in the roughly 10% of our users who are in the developed world, they too are bottom of the pyramid, as best we can understand through the demographics that they give us. The majority of our users are urban, and the majority of them are male. And I have to say, this chart puts me in mind of my third grade teacher who would sit down at report card time and say, well, we have some opportunities for growth. And I think I'm very keen to learn from all of you what strategies you're using to equalize the divide between our female and male learners. I think it's a common problem we all face, and we have some strategies, but we clearly are not yet doing enough. Finally, in terms of our user base, roughly 50% of our users are in some kind of tertiary education program. The rest of them are either before or after, or in some kind of, or purely self-learning. So next I'm going to present a series of strategies that we've adopted in designing for the bottom of the pyramid. And by design, I mean both what Russell termed this morning delightful UX. I give you fair notice, I'm going to rip off that fantastic term. And in the way that we architected the site to reflect what we are learning from our users about what they want and need to ensure especially relevance and feasibility. This is the contextual holy grail that we're all talking about. And these, we know, are the key determinants of engagement and effectiveness. So right off the bat, I would talk about flexibility. We designed HP Life to be a so-called direct-to-consumer, self-paced, do it in your anytime, anywhere, one learner at a time mode. But we also have embedded very robust tools right there on the platform to support intermediaries and educators who want to use HP Life in their classrooms or training centers or kiosks or in whatever context they are working. And much of these resources are actually user-contributed resources. So we have community college teachers, trainers from rural India who've contributed sample syllabi, video, recommendations, assessment questions for each of the 4 use cases that you've developed there, which prove to be the 4 ways in which HP Life is being used in these intermediary contexts. And I think that these ancillary modes of working with MOOCs are something that we are all recognizing are really important for effective dissemination in the broadest possible way. And they're also a key way to localize outside of the platform that you built. The second thing I want to note is that we need to get away from the idea that we are building the traditional just-in-case resources where you learn a bunch of stuff that you might eventually apply to something you need to know. Adult learners need just-in-time resources. They need things that are really relevant for a real problem that they have to solve in real time. And those bites might be very small and modular. I think someone else noted this morning that our metrics for success are getting outmoded because for a user, they may come into a platform, find what they need in 10, 15 minutes, go away, never come back, but they had a 100% successful experience with what we're teaching. Next thing I want to note, and this is a real challenge, and it's rare, to be honest, in the MOOCs that I've seen, is significant and robust interactivity. And by that I mean not just the opportunity to type into a discussion forum, but especially to practice skills and master them. So the kinds of things that we allow our users to practice on our forum are things like building a website, negotiating a salary, developing a spreadsheet to track profit and loss. And you know, we talk a lot about the disadvantages of learning online. I think one real advantage in learning skills online is that you can repeat something over and over again, get it wrong a million times. There's no shame or sanction. You can achieve mastery on your own, in your own time, without any negative recourse, right? And for learners in developing contexts, this opportunity to learn away from the scrutiny of their peers sometimes is a very significant benefit. Everybody's talked about responsive design. What do I want to say about multilingual? I think the ship has sailed. We can't offer these things in English alone anymore. It is essential if we are going to be a global presence to offer them in as many languages as we possibly can. HP Life is currently available in French, Portuguese, Spanish, Arabic, English, In a couple of weeks, we're going to launch in Hindi, about a month after that in Mandarin Chinese, and we're just about to start the very complicated and challenging process of translating into Burmese, for which there is no standardized font. Microsoft, you need to get on that. Here's probably the first example of delightful interface, or as close as we come to delight. We use a lot, this mechanism is that you may recognize as a kind of fotonovela approach. It's low bandwidth, it's high impact, it builds on storytelling and narrative and character-driven problem solving that are very familiar to people in the communities in which we're working. Our Google Analytics tell us that these are especially popular with our female users, and so we want to find other mechanisms like this that will be appealing to those groups. We don't say enough, and we don't walk the walk enough in terms of user-contributed content. Easily the simplest way to do this is to build robust discussion forums and to incentivize them so people participate in meaningful ways. I loved what Russell presented this morning of a real-time discussion that toggles back and forth while people are learning. So it's not a before-after thing, it's in real time. We also look at and learn from what's being done on marketplace and shopping websites in the way of incentivizing user engagement and drawing on peer ratings and reviews so that the market, in effect, tells us what's the most valuable content. And users will really compete. We've learned, and you all know this already, to be featured as a top user, a top contributor. You can see, I pulled this off the website months ago. I'm a really bottom of the pack user, and I've been motivated to do better since. I'm sort of surprised we haven't heard much at all about virtual mentoring. It's very effective, it's a very high value to our users, and it's relatively inexpensive to deploy. I think it needs to be tied to the rewards for engaging more deeply in the platform. If you engage more deeply, you earn points and get access to mentoring. And you need to do it in a variety of ways so that people, for example, who don't have constant access to strong bandwidth can still work with a mentor. I think we've said a lot about certification and how important it is in these contexts. Here's my summary slide about our design principles. I'm a technologist, but I think it's really important that we start with the problem and with the user rather than with technology. But when we use technology, we ought to consider what it does best. Global collaboration, swift, instant transmission of information and tools, location-enabled services, and the use of images and video anybody can download or upload, and importantly, scale. How well does it work? I'll give you a little bit of outcome data from HP Life. We've been live for just under a year, and these data are quite recent. Most of our users have been on the platform for 6 months or less, so it's new data. Our course completion rates, with the caveat that this isn't the best metric for what works, but they're really good. If you are in the MOOC space, you know 43% is almost unheard of. Our user satisfaction, again, is extremely good. Self-reported user satisfaction is very high, with the methodological caveat that those users who reply to our surveys tend to be those who completed the work and found it to be useful. This is probably the most important measure of impact. These are the actual short-term outcomes, and they include things like expanding my business, increasing my income, increasing the number of people working in your company. So these are real changes in people's lives that have come about as a result of their engagement in the platform. And these are the kind of outcomes that our funders and our communities care a lot about. So we need to be looking at these kinds of things and assessing them. Last slide, this is the kind of thing that we show at the beginning of the meeting. It's a quote from the forum from one of our users with the photo, and she's going to be putting together a hot dog kiosk. You know, you just can't beat that. That's the kind of real-time impact that I think makes us all feel really engaged. Thanks so much.
Thank you, Rebecca. That was great. Our next speaker is Litman-Quinn. He's been working with me in Botswana now for 4.5 years. Time flies. And he's going to talk to you today about his work in higher education with the University of Botswana and how we've been able to use technology to enhance their education and how MOOCs may fit into the education in that setting, right?
Thank you, Carrie. Good afternoon, everybody. It's a pleasure to be here, panel members. So as Carrie mentioned, my name is Litman-Quinn. I'm the Director of Mobile Health Informatics with Botswana UPenn Partnership. And today I'm going to talk about medical education, mobile technology, and the potential for MOOCs in this environment. Great. So before I dive in, just a little bit of background on the Botswana UPenn Partnership. It's a partnership between the University of Pennsylvania, University of Botswana, and the Ministry of Health in Botswana. It's been around for, I think, 11 or 12 years now. Started in response to the HIV epidemic. Our program is the Health Informatics Capacity Building Program. We've been around for 4.5 years. I've been based there managing this program on the ground. We do curriculum development, workshops, we run a national conference every year, and we introduce, evaluate, and sustainably scale up mHealth projects. And one of these projects, which is one of our cornerstone projects on medical education, is what I'm going to share with you today. So first I'll start by going over some global health challenges, then talk about mobile technology trends in low and middle income countries, give a little bit of background on Botswana, talk about our mLearning project, and then finish up with the potential for MOOCs. So as we all know, there's a big healthcare shortage around the world. In the USA, there are roughly 5 doctors for every 2,000 people. For context and comparison, in Botswana, there's roughly 5 doctors for every 12,500 people. And Botswana has it pretty well off compared to a lot of other sub-Saharan African countries and other countries in Southeast Asia and other parts of the developing world. And this issue, well, sorry, just take a step back here. Not only is there a shortage of doctors, but there's a shortage of access to these doctors. They're mostly in urban areas, and the infrastructure isn't very robust around the country, both physical infrastructure for traveling, but also landline IT infrastructure. Fiber optic cables only go so far. But one type of infrastructure that is spreading around a lot is mobile technology. And now I'll just go through a few stats that kind of show the different global technology trends around the world. So the percentage of the world's population covered by a mobile signal was just 61% in 2003. 2009, that had jumped to 90%, and it's projected that by 2017, 85% of the world is going to have some sort of high-speed mobile internet. And not only is the network expanding and getting stronger, but the technology is getting much more accessible. So the percentage of mobile devices owned by citizens in the developing countries was 25% of 700 million in 2000, and by 2011, that was 76% of 6 billion. And this next slide shows the growth of the different types of mobile devices. You see the red line there is actually smartphone devices. So as of last year, there are more smartphones in the world compared to feature phones and other phones. I think there's 1 billion last year, and they're projected that it'll increase by another 1 billion in just this coming year. And most of that growth is going to happen in low and middle income countries in developing markets. So obviously all these trends are very promising. Quick background on Botswana. Challenging landline IT infrastructure, high mobile technology penetration, very representative of a lot of low and middle income countries. Ranked 2nd in HIV prevalence and 4th in TB prevalence in the world. So the healthcare system, in addition to these issues, is burdened by these infectious diseases. As mentioned, severe shortage of healthcare workers. And however, a promising thing is that the University of Botswana launched their first School of Medicine in 2009 as an attempt for them to start building their own capacity, training their own doctors to help with all these issues that they're experiencing. So what we've done is we partnered with the University of Botswana School of Medicine on this mLearning for Medical Education project. And this project's based on a fundamental theorem, which is a timeless informatics fundamental theorem, but one that we've kind of customized for this project. So if a 7-inch Android tablet easily provides access to university library resources, access to international research, local treatment guidelines, drug and dosage references, ability to communicate with your peers and mentors, which we all know is very important, in addition to countless more medical knowledge resources, then a tablet plus a human brain is better than just a human brain on its own. This informatics theorem, as you can tell, can be scaled, and this has been kind of our overall approach to this, and why locally with the University of Botswana and a lot of local partners, we've seen a lot of promise in this project. So these are the partners on the project. It's a public-private partnership. University of Botswana, we partnered with the School of Medicine, but also their library, which is very important. Orange Botswana is a private telecoms company that gave us, it donated SIM cards and data for the pilots, and then customized data bundles and gave discounted rates as we scaled up the project. They worked very closely with the UB Library on that. Mango's Mobile is a mobile tech consultancy company that helped with the implementation and the strategy for it, and then ourselves in this Botswana UPenn partnership. So you can see the growth of this project over the years. Started as a pilot in 2010 with 7 users based in the capital city. By 2014 now, 280 users, not just in the capital city, but in all the locations, the rural locations around the country where the medical students and residents rotate as part of their academics. These are a few quotes from some of our pilot users. As you can tell, they're very grateful for the devices, the information that came on them and that it connected them to. Here's a quick look on the operational side of this project. So a big part of our capacity building was training the University of Botswana staff, the library, and their distance learning specialists on how to set up these devices and how to do it in an efficient way. All 280 devices were set up by University of Botswana staff and also volunteer students, and just develop some step-by-step guides on how to go about doing that and how to keep them secure. All the trainings, the initial trainings, were about 2 or 3 hours depending on the group. Trainings didn't just cover the medical resources, but also just basic digital smart device hygiene that a lot of us know, but a lot of people out there who are using mobile technology, smartphone devices for the first time aren't aware of. So just how to set up your email, PDF readers, look out security apps, having different passwords. All these things are covered in all the trainings, and all the trainings are delivered by University of Botswana library staff and distance learning staff. So just a few more photos. Okay, so now I'll shift over to MOOCs and the potential there. I think short term we'd all agree that there's a lot of opportunity for supplementing the current local medical education content, such as the project we're doing right now. If a student is taking a certain course and there are existing MOOCs that can supplement that, it's quite easy to share with them, encourage them to utilize it. Medium and long term, I think a lot of these have been covered by other talks. The content obviously needs to be customized locally and regionally, delivered, available in the local language, offered through the local community, through local academic institutions, libraries, I think is important in terms of expanding the reach. I can't emphasize enough the importance of public-private partnerships as like a foundation for projects for sustainability. And then one last thing that I want to spend a little bit more time talking about that I feel like hasn't been discussed too much, at least in the panels that I've attended, is trying to expand the reach and the impact of MOOCs. And I use the term unplug and came up with this new buzzword that I part of me hopes it doesn't become a buzzword, but MOOCs or MOOCs. I think a lot of us have noticed that when we think of MOOCs, we think of people crowding around desktop computers or laptops using bandwidth-heavy multimedia. But as I showed earlier on these projects, there's a lot you can do with mobile technology, and not just smart devices, but also lower-end mobile technology. And that's what I just want to talk about for a quick minute. So who here is familiar with what USSD is? Does anybody know? Just by a raise of hands. So I didn't know what USSD was either until I started working in this space. But USSD is a different type of mobile technology. It's not voice, it's not SMS, but it's available on every single mobile device, smart, feature, dumb, what have you. It creates a constant connection with a database, has a 182 character limit per menu, has unlimited menus and time. Theoretically, the different private telecoms can set limits on the amount of time of their USSD sessions, and also they're free for the user. And like I mentioned, they're on all mobile devices, and they have been used in social media, banking, sports scores, and sports gambling actually is a growing thing in South Africa. And there are some startups also in South Africa converting Google Maps and other services like that to be available over USSD. So this is a very promising technology that I think unfortunately hasn't been applied to health or education as much as it could, but also holds a lot of potential for expanding MOOCs content and delivery right now to the technology that's available at the base of the pyramid. These are just a few screenshots from a USSD project we're experimenting with, providing pneumonia treatment guidelines over USSD to doctors. So a doctor would dial something like *154# and be entered into a USSD session, where then they could be walked through the pneumonia guidelines for the country. And I feel like this could be complementary to MOOCs. Maybe you don't deliver a whole course over USSD, but it could be a supplementary thing. So a student is taking a MOOC course, but then they're available once they're away from the environment in their community where they can access the MOOC. Maybe at home they just have a feature phone, they could still do some quizzes or be walked through some modules on that. So in conclusion, mobile technology can support medical education in low-resource settings. Capacity must be built for sustainability. In global health, MOOCs will have the largest reach and impact when the content is locally customized and delivered, supported by public-private partnerships, and utilizes the most appropriate technology, such as MOOCs or MOOCs, as I mentioned. Thank you very much. Acknowledging the partners in our projects. Feel free to contact me if you have any questions. This is a QR code. If you do it with your phone, I'll automatically be added to your contacts. So thank you so much.
Great, thanks, Ryan. Great, so we'll have one more talk and then hopefully we'll have some discussion afterwards. So our last speaker is Charron, who is an instructor she's on the faculty of the Global Disease Epidemiology and Control Program in the Department of International Health at Johns Hopkins University. And today she's going to be talking about From Campus to Village, the use of MOOCs for global health education. Charron?
So I'm too short to stand behind it, so you're going to have to maybe adjust the mic because it won't see me at all. So I'm happy to be here. My name's Charron, and I can hold this. And in coming here, I was trying to think what I brought to this MOOC4D, and I think one is that I teach a MOOC. I've taught this twice, and I teach online. So what I'm going to talk about is my experience and my real passion for getting the information to the individuals who need it to make public health decisions. And the example that I'm going to talk about is the MOOC on vaccine trials. Now, vaccines is arguably the most efficacious public health measure we have, and yet it's very hard to get sustainable immunization coverage. And part of that is not only just knowing about them, but being able to actually dialogue about how vaccines are studied, so the trials. So that's why we put together this course, and we also have been teaching it at a graduate level for several years. So, let's see. How do people find information about health? You know, I mean, put ourselves, right? I mean, if someone says they have, you know, some kind of illness, first thing you do is you do a search for it. And that's really not the way to learn about public health things, because there's an awful lot of misinformation out there, and most people don't have access to that, right? So you're not getting the journal Vaccines. So those that are doing the research in vaccines and publishing, that's fantastic. But the people that have to make the decision about being in the trials or being uptake of the vaccine, don't see that data. What they see is the Today Show and CNN, and they see, you know, things about scary stuff about guinea pigs and not fearful of vaccines. If you Google, I do this every time I talk about this, I did last night, so really quickly I got 6 million hits on vaccine dangers. There's a lot of information about how scary these are and a lot of misinformation that don't at all correspond to the evidence base in this topic. I love that one, poison by design. So we're not only poisoning, we're doing it on purpose. We're killing kids on purpose. And things like death of your child. Now, if you have a child and you're on the internet and you're looking at this, you're going, you know what, my kid's healthy now. I'm not going to get them the vaccines. And that scares us as public health practitioners, that people are getting that information from static sites, and static sites that look really good. So this is what we look like. Our public health sites are very full of great information from CDC and Institute for Vaccine Safety. They don't look nearly as slick. And although this one I love because I'm a public health person, it's fantastic information on the history of vaccines. Stanley Plotkin literally wrote the book on vaccines. But I don't think moms are going there to find, you know, to find out about vaccines. So I think that we really have wanted to engage with people about the topic, not just put information out there, which is what we've done for many years. So we've talked about this, the access and doing assessments so people can figure out what their literacy is and engaging them. So this is the class that we put together, me with some colleagues, and it is a subset of the graduate class that we do, and it launched for the first time in October of 2012, and we've taught it since then, last summer. But we really were interested in doing this for a long time. So my team also goes out and trains people in developing countries to do vaccine trials. People knew that we had this online class. I said, Karen, can we take the online class? Well, it's awfully expensive to take a class at Hopkins, and it wasn't accessible. So when this opportunity came along, we were really excited, my team, to jump into it. And we jumped into it with those people in mind, right? So we were training nurses, doctors, clinicians. Okay, see. That's who we expected, and we put that on the site. We expect these individuals to show up and take the class. We've designed it for you, please come. And we were partly right, but not completely right, because we had people who had no background at all. And so we had 41% who admitted that they didn't have any background in vaccines. So the course is built at that point. You go, okay, well now I need to make sure that we have enough people that can engage with them when they're learning something for the first time. But it showed the need and the interest. It was really interesting who decided to take the class. The structure is very much like many of the MOOCs, where there are lectures, but they can be downloaded. There are MP4s that they can take with them and keep. So they're not things that we have on our own server. And they are captioned, but they're in English. And that is something that also we recognize needs to change. We do have a quiz base, but we tried to make it something where it's analytical. In our class, they write a consent form. In this class, they critique one. What can you do when you're working with thousands of people? I don't think you could grade 1,000 or whatever, even 1,000 consent forms. But we're thinking about doing peer evaluation of that, and we haven't built that into the next offering yet. Heard a lot of people talk about what success is, and I'm completely in the same camp. Success isn't these people. It's not how many people you got to enroll. I know when we first started doing this, you know, that there were 10s, 20, 30,000 people, and people would ask you, well, how many people are in your class? Well, we had that many, and we had about half of them looked at least one video. And 3,200 did at least one quiz, and what I found really interesting is if they actually had an intent to complete it, 58% of them did. But I think those individuals that looked at one video, that did one quiz, they got what they were looking for out of it. And we think that's very successful in public health. They went in, they looked at what they wanted. One thing I did different than my colleagues is I left all of the assessments open all the way through the course. How many of you have taken a MOOC? How many of you finished the whole thing? You have? Okay, I have not. I know, I can't lie. I can't lie. Okay, you finished, okay. It's tough to, when they have the timelines, you have to finish it and I'm like, oh shoot, I missed that timeline. I'm not even going to look at that class again because I can't get the certificate, so I walk away. So we kept ours open for the 7 weeks. It meant that we had people that were at different stages, but it worked out. It worked out. People liked it. I've heard people say that, you know, those who respond to surveys do like the course, and they were the individuals who got the statement of accomplishment that I'm showing. We do have data from people who didn't, those that responded. They're using this statement of accomplishment in different ways, and Hawkins' relationship for MOOCs is with Coursera, which is the same as UPenn. But for this group, what I found interesting is people want this information. People said, yeah, I'd really like to take another advanced course on this, and you can say advanced course on vaccines or just global health topics. So, and there are very few courses out there on global health. And our course was the first that actually had anything to do with ethics of human trials. And there really isn't anything else out there that I'm aware of. Maybe there is something in some of the other platforms, but I haven't been able to find anything that's free and open about how are trials done. And if you think about one of the things that motivates people to make change, they need to know how things were evaluated. We had people from all over, and that was the most rewarding thing for me. Why am I, as a teacher, teaching this? For 14 years I taught in a graduate level. Why am I jumping into this crazy thing? And it was fun. It was fun to have all these people. We also recognized, we had planned to be engaged all through the course and having dialogue with them, but when we had that very clearly early on, we knew we had such a heterogeneous population, we knew we had to be on the website, and we're a little obsessive compulsive as a team, and so we were on the website all the time. People were doing what they could. They didn't speak English well, so they were using translators, and that's fantastic that she posted that, but that we shouldn't have to be doing that, obviously. We did have everything designed so that they could be scannable, so all of my educational material for recruiting, I had to do the stuff where it said mosquito, and it had to say, so you had to do all the PDF annotation, which takes a bit, but it was enable people to have screen readers. So people liked what they learned, and so this was rewarding for me. People see it's mind-blowing how much paperwork and how much work it is. So this person got a sense of what it takes to do a trial. It is very hard to do. But we also had people post, I can't play this video up here, but post some really wrong information, and that was really hard for me to sort of step back from the computer and let the other users in the community interact with it, and people would look at the sites, and you would see different people commenting on the validity of it, and we would jump in to moderate when we needed to, but we tried not to be the first to do that. Actually, we did do the first once, and then we realized, okay, don't do that. Let's see what happens with the group, because people felt they weren't being heard. I mentioned we left the quizzes open, so we had people jump in at week 3 and week 4, and that was fine with us, but that meant that people weren't done, and we hadn't thought of that. So it was a 7-week class, and at the end we had people say, could you keep it open for another week for us to finish? I figure it's a free class, sure, it didn't matter to me. So we left it open. Well, people posted that we were not upholding to our bargain, and that we were cheapening the class by leaving it open, and people who couldn't do time management. And this poor young man posted this and said, listen, it took me 6 hours to get to a place where I could get to the internet, and I really thought I couldn't even get the certificate. I just wanted to do the last quiz. I'm so thrilled. And it went on, not all of us are American, he said, and we don't all get access to everything. And that's very true. So you have to be flexible. You have to really try to listen and know that you're not going to make everybody happy, but I'm happy that I made him happy. We offered it a second time last summer, and I was actually in Nepal when we were offering it, and that was really fun because I was posting and I was in more of the same time zone as them, while I had my other colleague in Baltimore, and so we were able to do discussion forum conversations sort of around the clock. And I got an email from one of the students in the class and said, you know, oh, I see you're here. Can you come to my university in Kathmandu? And it didn't work out, but I thought, oh, how cool. If only I could have gotten there. There really is a community out there of people who are interested in the material. They weren't just going through the quizzes. So that was also very rewarding to see that. So I started by saying that, you know, this is campus to village, and I think that's really what we're trying to do. We do in public health and in graduate level work, we do have knowledge that is somewhat one-directional as far as factual evidence of this. It's not quite as much open for debate, but you need to hear that and talk to people where they are so that you can engage them. So I think MOOCs are ideal for global health. I think you do need to chunk them. I think that's what you said, small videos, small amounts. I think we could do probably a better job of doing a little bit more modularizing than what we did. We had things each week open up. Really, this is about transparency, literacy, and trust. People can't just go to a website and find information out, and then they're going to go and they're going to have an uptake of an intervention like vaccines. It's just not going to happen. And really, my public healthiness, my social justice person hates that people couldn't take things because they couldn't afford it. So I love the opportunity to teach where people don't have to worry about money. One of the things I forgot to say is that the 1868 that finished in the first course is more than the total I taught in 14 years of my class. And, you know, these people were much more excited. They didn't really whine over points, except the person who thought I kept it open too long. But it was really fun to do, and you knew you reached people. But it's a lot of work, and a lot of institutional resources are needed. So I don't know what it takes at the upper level, but at our level, the workload is, you have to want to do it, because you're doing this really weekends and evenings while you're doing your research during the day, and you're doing it because you feel passionate to get it out there. So I don't know if another model could come along where there actually would be faculty support. That would really be nice. Or and I think we all did get some support when we built them, but we believe you should stay engaged. And in order to do that, you need to have some support. So I think it's very, very rewarding. And I guess I just say, if we're not going to really engage with them, I'm very scared about who is going to engage with them and what really is going to be happening in the public health. So thanks very much.
Thank you so much. So I think we'll open it up for questions. It would be great to have a discussion. Anyone have any burning questions off the bat? Yes?
Hi, just ask one question about mobile. As I explained in my conversation yesterday, we've been very much focused on mobile devices. That's not because Microsoft do much in mobile devices, to be honest. Although we were now acquiring Nokia, when we started that work, we weren't doing that. It was just a practical response, recognizing the fact that everyone has a mobile, and it would be insane not to utilize that platform. To what degree do you think we should put more focus on mobile MOOCs and things of that nature, given that there's a platform already in C++ that we're not using?
Yeah, it's a good question. Do we need to respond?
Yeah.
Maybe just try and summarize the question.
Yeah, sure. It's an hour.
We need wireless technology.
Yeah, I know, right? Get rid of these wires. That was a good question. I think. Hello? It was a very good question. It was generally about how do we best approach utilizing mobile technology for MOOCs. I think that's a simplified summary of it. So I think a lot of it's already kind of happening because of the huge growth of smartphone technology, tablet technology, etc. And a lot of it's translatable if you just have a browser to be able to utilize it. Like I mentioned, I think that USSD is wildly underutilized when it comes to health and education. And I think that just has to do with there are some barriers out there because you have to go through private telecoms in order to get these short codes and do them one at a time. It's a bit of work, and they're for-profit companies, and they're going to prioritize USSD applications that are revenue generating, such as sports gambling apps or mobile banking apps that offer more revenue. So I think conferences like this are great to kind of bring these issues up and get people from public, private sector together, maybe engaging something like the GSMA to get involved, to try to push to get more of these MOOCs technologies on mobile technology that's on all mobile devices right now, as opposed to waiting around and waiting for everybody to have smart devices and high-speed internet everywhere. That's my thoughts on it.
I have a colleague at WHO who likes to say that, quote, the factoid that there are more mobile phones than latrines in India. Mobile is where our users are. We have to go there. I think the limiting factor has to do with, and these are interrelated with cost and interactivity. So here's another factoid. In South Africa, families spend more on data for their mobile phones than on groceries some months. It's the back end of building a truly interactive learning experience doesn't operate, but responsive design, I'm trying to simplify this for non-techies, responsive design doesn't give you all of that. In other words, it's not just collapsing it into a single column. If you want to have somebody be able to build a spreadsheet or do something that requires dynamic feedback, you're going to have to build a native app. And so that's very expensive, and it consumes a lot of data. So there would be, I think the holy grail is getting to the place where we can have people have equivalent learning experiences on mobile devices, or even better, when we keep in mind that mobile is social and location enabled in ways that a PC is not. And so we should be thinking about what mobile does best and building those features into the learning experiences that we're creating.
Just wondering if any of you are working across the public health, nutrition, agriculture spectrum. You know, there's a lot of connections there, but I think things tend to go in health and agriculture. So, just curious.
Well, we have there's a food MOOC that we have at Hopkins. Yeah, that we've so actually, and I know food MOOC. I can't think of the name of it, Bob Lawrence, but really it is a nutrition agricultural blend of looking at where we're going with food security, food safety, those kinds of things. So, and I believe there's discussions of putting a nutrition class that we've had online on. I don't think there is one. I think you're right. I don't know if a nutrition one MOOC, if anybody knows about that, but. I'm in the Department of International Health, and the looking at immunity and food and nutrition and all of these things together happens all the time, but I don't think they've made it into a MOOC.
I haven't, but one of my colleagues built an early and very successful app which was deployed in Mali that allowed farmers to, in real time, access market prices for their crops so that they could make decisions about where to take their crop on Thursday and not be at the mercy of whatever the market price was here as opposed to there. And your question makes me think that we ought to flip that around and have consumers, mothers, be able to access the market prices so that they get to the places where they can buy the most food, the healthiest food for their families with the funds that their family has that week.
There are plenty of nutrition MOOCs in Coursera alone, including equine nutrition. So crossing over into
What is the food class? I can't remember Bob Lawrence.
there's all sorts of different ones. Science of gastronomy, nutrition for health promotion and disease, child nutrition and cooking, economic issues, food and you, the meat we eat, a number of them.
Yep.
Yeah. I have a question about dissemination strategies. So you build awesome content, you're confident that it's changing people's lives. Maybe this is more relevant for HB Life and for the public health MOOCs. But do you just wait and hope, that the right people land on your course? Or now that you're like a couple seasons in, do you think differently about ways you can reach those who might not automatically kind of have access to,
To know that it's there.
to know that it's there, yeah.
So it's a great question. I think everybody who builds any of these things has to think from the moment they write the proposal to get funding or gets together in a room with some people, friends, colleagues who are excited about doing this, what are the multiple channels we can use for dissemination. For HB Life, because it was a public-private partnership and we had a sponsor who was willing to kick in the funding for this, we did some social media ads. So we bought Facebook banner ads, and that helped us to get started. And then there is a kind of viral thing that happens if you build something good. We also built within the course a tell a friend button. There's a post your certificate to Facebook or LinkedIn. That is another way that people hear about the MOOC. As I noted, we consciously reached out and added dissemination partners, National Association of Community Colleges, groups in India and Africa that do training around micro-entrepreneurship, and worked with them to reach the audiences that they had that shared this mission. There are a lot of other strategies. I don't want to hug the microphone.
I'll just say, I think social media is an obvious, foundation you should start with. We've also found a lot of positive experiences with our public-private partnership projects, utilizing some of our partners, their private marketing departments, getting radio ads, TV spots, stuff like that in the traditional media that, when you have more partners involved, you can utilize more resources like that. So I just want to add that.
Yeah, to echo that, in the don't always start with technology, places like India and Africa, billboards and bus ads are really often the way that people hear about new interventions. And Ryan, perhaps this is what you meant on the public-private partnership. We have another project that's has a telecom partner, and they load the content onto their phones. And that content, it's a basic literacy course, and the content has exceptional value for the phone users. The telecom benefits because people will buy their phones rather than their competitors' phones because it has this content on it. And the users benefit because they get the content effectively for free. We benefit because we don't have to pay anything for the dissemination strategy. So look for win-win kinds of avenues and get your users to work with you to spread the word.
For vaccines, it's a small topic, and it's a rather small network of groups that work with that and that have field sites. So we directly marketed to groups that had field sites that were working on epidemiological studies leading to vaccines, vaccine trials, or immunization programs. So, and we had like 13 people from the Ethiopia site take it together, and people from the Nepal site. So, but I wasn't aiming for super high numbers. I was happy with what we had, but we did do the marketing to the individual groups and investigators.
I'm curious about, you said you were surprised by how many lay people showed
Yes.
up for the course. What do you know about how they heard about it?
So people posted on moms boards, and so now we post them now also. And so my colleague, I have to admit, I'm not a Twitter person, but Amber is, and so there's Twitter, and she's also a mom, and so she's on all these mom boards also, and so we were able to get quite a lot of traction from those kinds of things. And yeah, so we weren't really expecting that in the beginning, but we found our course in places we didn't advertise, which was kind of fun.
I'm sure this idea is not new, but it's popping into my head because of all of our developing world colleagues who are with us here, and it's an idea that would come out of their tradition perhaps more naturally than ours, but making use of the elders community. Because you, Karen, were talking about you don't have time, you're an active teacher, but you still want to get the stuff out for free. What about the very large community of emeritus faculty or retired faculty who would love to be able to continue contributing, but maybe don't have the stamina to do the actual physical teaching anymore, but could help with course development, could help with monitoring, could help with engagement on the discussion groups?
That's true, and also doctoral students. So we've engaged doctoral students, and that's been fantastic, and they've had a very rewarding experience with that. But we really haven't. I don't know. I don't really know public health people that retire. I mean, one of my closest colleagues is 94, and she works full time. So.
Yeah. And the reason I say this is actually my father works in public health and is
Did he ever retire?
He did not officially retire, but the reason this came into my mind is his health is forcing him to retire. He has Parkinson's.
Oh, yeah.
So he can't speak in front of a class anymore, but he loves to stay
It's a
engaged.
really good idea.
So
That's a really good idea. So then the metric is also, it's also altruism. So if we can find people like that, because there isn't a compensation method really in place for us.
Just to touch upon that, I think it's a really interesting model, and another project that I'm involved in is called the Swinfen Charitable Trust Telemedicine Network, and they do a similar thing where retired specialists, dermatologists, whoever, they volunteer their time, they'll be a specialist, they'll accept complex case referrals from anywhere in the developing world, and they volunteer it, and I think it's a little less than half of all the specialists are retired and just want to still contribute and have the time. So it's a model that's been proven to work in some other settings. So it's an interesting one, I think.
Other questions?
I had a question, if I'm allowed to ask one. So
in front of your camera.
Yeah, right. So with the conversations that we've been having over the last couple of days, and also with your own experiences in the field, I'm wondering what kind of metrics you have in place for identifying, which populations you're reaching with the curriculum that you're developing, ideally for this target population. How are you doing that, and if there what have been the main limitations for going deeper into that target population, if that is your population reaching these most marginalized communities?
Well, I have an easy answer to that. So we partner with the University of Botswana, and so all of our work and our target audiences are their student body and their people. So it's just medical education. Exactly.
In the higher education.
It's within the higher education realm and environment, and we're really there to just support them and build the capacity in their institution to be able to use mobile technology to support their students when they're out away from campus. But I do agree that there's a lot of opportunity there. I think maybe some years down the road for them to be able to offer their own MOOCs for certain subjects that are relevant for the local populations and for the more.
Might describe health to the individuals they're treating.
Exactly,
Yeah.
exactly.
That's
More like public health information resources and public education resources for the population or for their patients.
Well, because our course is truly massive, we do make extensive use of embedded analytics, as Russell and his team do, to understand who our users are and what their experiences are, where they're spending more time on the course. And we very aggressively solicit feedback within the courses themselves with follow-up surveys. We try and stay behind the threshold of making people feel hounded by us to contribute information about their experiences. I think, however, this is another opportunity for growth. We're not yet using those data in the very best way that we can, in part because the nature of a very disparate, large global community means it's hard to make aggregate kinds of assumptions about what next. For example, we've asked our users repeatedly and in a number of ways, surveys, polls, quizzes, focus groups, interviews. What kind of content do you want next? And if you were to plot those responses, it would look like a shotgun blast. Mm-hmm. So it's a challenge with a very large and heterogeneous user base to understand and see good patterns for what to do next. The outlier stuff we can see. We found some things early on in the program where people didn't spend much time at all. We do a lot of user testing, and including videotaping people as they're on the platform. They're good software tools that will allow you to do that very inexpensively. And it's so valuable and it's so hysterical. You watch somebody going, shit. Where is that next button? You know, you can really vividly understand what's working and not working by watching what your users are doing. And if you build the right kinds of feedback loops, they'll tell you also.
It's not exactly your question, but as far as the heterogeneous group, we did a more in-depth pre- and post-test of knowledge that is in the hands of a doctoral student. So I don't have the data for that, but we actually hope to publish that to see, does this actually shift people's knowledge when you do it in this environment? So I don't know, but I hope to know.
I guess the last thing I would say is you have to be really intentional about this. So build your platform in ways that it can support what your users want to tell you, so that it makes it really simple for users to upload video content or images, or to give you feedback, to be engaged in discussion forums, to tell you about something that isn't working, or give an example to their peers of what they've done or need help with. Because ours is a platform designed to support livelihoods, we actually built an embedded marketplace, so people can exchange not only knowledge but goods and services, with the idea that that's how, that's going to give them the most important outcomes at the end of the day is an increase in their incomes, which is a core determinant of health in developing contexts, as you know.
Any other questions?
Can I ask a follow-up?
Yeah, sure.
I just want to say, full marks, tiny audience for engagement.
Yeah,
You guys were superstars. Thank you.
Thank you.
Go ahead.
Okay, so with your, I guess for both of your projects that are focused on different aspects of youth livelihood and then the health aspect, I think, right? So you said it's not there yet, but maybe in the next 5 to 10 years you can approach that. But then you do have this technology that you're mentioning, this USSD, I think is what the acronym is, that you can do something much sooner than 5 years down the line. Yeah. So how do you adapt that to incorporate that into your program? So maybe you're not just looking at the higher education population, but then start going into these like lower tiers of the pyramid, I guess you could say, and then with HP Life, I guess the question becomes, so the platform itself is online, and it has this, it requires the bandwidth or do you have an opportunity there to reach communities that don't have access to computer labs or internet, and how would that look different from the current platform that it's in that you just presented on?
Okay.
So to answer your question, I completely agree about the technology's there right now. The content is there. I think the people are there. It's just about getting the people together in the same room and bringing it back again to public-private partnerships. In a country like Botswana, for something like this to happen, you need to have a partnership. You need to have the Ministry of Education involved. You need them to be partnering with the 3 major telecoms companies that are there. Botswana's fortunate they only have 3. Other countries, they'll have 7, 8, 9, 13, but you need to get all the telecoms involved, or the other telecoms miss out, and it's a PR thing where you say, yes, you can do little standard 5 math quizzes now or modules through through only these mobile network operators who are willing, but I think like I said earlier, the biggest barrier right now with USSD is that you need to go through each individual telecom in order to get a short code on it. It's there, it just takes some time and resources and people setting aside the time and resources to meet and make a plan to do it. So yeah, I think it's just about a force coming together and trying to get these public-private partnerships going. And you know, it's not necessarily one type of partner or another that's supposed to take the first step, but that's what needs to be done, in my opinion.
So I have a three-part answer. I'll try and be swift. The first is that we were very intentional in our design and our pedagogical strategies to bear in mind the requirements of minimal bandwidth. So we use telenovelas as opposed to videos because we did extensive user testing, and there's nothing on HP Life that presents a challenge in a low bandwidth context. We know it works really well in low bandwidth. It's also available in a slightly less interactive offline format for places that can't use it, and of course anybody can download and use it offline. Oh, I'm of the age I should never say I have three parts because I won't remember the third. Somebody bail me out. Yeah.
Okay, so those are the main differences in the online and versus the real-time, the standalone.
Yeah, we heard here from somebody who's built a really nice small portable technology device that will allow you to effectively replicate offline lots of cool online stuff in classrooms. I think that's something we should all pay attention to and see if we can adopt.
So would that still be considered a MOOC then, because it doesn't have that online aspect?
Well,
it's just a matter of identifying it.
The origins of it, the content is online, but you bring it offline and are able to dissect it.
But then you also can plug it in when you are back online, and it uploads the content that, whatever discussion you've posted in the forum or something. So I think the technology will always evolve more swiftly than the political barriers, the fiscal barriers. All those other things are bigger challenges. The literacy skills of our learners is a very fundamental challenge, and that's not going to change as quickly as the technology and the price of technology.
Also, engaged students, biomedical engineers are amazingly creative and thinking about these things, and there are more and more of them wanting to go and have overseas experiences, and they may be able to find ways to shortcut some of that. And I also wanted to ask, your mentoring program that you have sounded really interesting as well, and I don't know how I would put that model in, but I liked it. The idea that they would get access to someone by doing certain things. I don't know how you put that in there, but.
So it's a basic points reward system. You're all familiar with those, I imagine. There is a little, it's not an inconsiderable or negligible effort to build the automaticity of that, whatever, to get the points. The bigger challenge is getting your mentoring pool. Again, because we have active involvement of a big technology corporation, they've made it part of their so-called employee engagement or corporate social responsibility. And I believe HP employees have the opportunity to volunteer on company time a certain number of hours a month. And so this is one of the many things that they can do, and because they're tech people, they love the idea of anytime, anywhere, being able to plug in, see who's online, find that, Ahmed who's got his bakery in Cairo and is wondering about how he's going to figure out the energy consumption of his ovens, and whether it will save him money to invest in a more fuel, efficient oven. And what would be the period of time in which it would pay itself back? Well, he's got somebody right there who's going to help him build that spreadsheet. Less resource-intensive ways to do it are to find a smaller pool of volunteers and get them to offer and archive webinars, if you can identify what the most significant needs are, or to run versions of a discussion, a moderated discussion forum where you have a so-called expert or office hours or something like that, where it's kind of a one-to-many mentoring program.
Okay, I think we better wrap it up. It's 2:30. That was a great discussion. Thank you, everybody, for coming.
We're going to clap it.